If you are interested to know how dopamine is working in our brain, what is the positive symptoms dominant schizophrenia? What is the negative symptoms dominant schizophrenia? What is a prolactin? What's the high dose dopamine act in a peripheral system? What kind of side effects are associated with the dopamine? Dopamine can cause a depression or not? So all these questions are going to be addressed in today's video, and don't miss this video if you want to learn thorough about the dopamine. Hi, my name is Nitesh and I am a registered clinical pharmacist and the career coach, and welcome to the Friday Pharma Quiz episode number 3. Today we are going to discuss 10 high yield multiple choice questions related to dopamine. Okay, so the question number 1, the relationship between the dopamine and schizophrenia. Mainly the schizophrenia is a positive symptom schizophrenia. The question is, overactivity of dopamine in which pathway is primarily responsible for the positive symptoms of the schizophrenia? Pause the video for a few seconds and give your response. There's a nigrostriatal, mesocortic, mesolimbic or tubuloinfundibular. I hope you have given the right answer. That's the mesolimbic. Okay, so positive symptoms schizophrenia is because of overactivity of dopamine at the mesolimbic pathway, and that's why we are giving the medications like a typical antipsychotics that has a primary mechanism of action is a D2 receptor blocker, and that is giving really good response in a positive symptoms. So what is the one-liner? Is positive symptom schizophrenia is because of the overactivity of dopamine in mesolimbic pathway, and that can be treated by blocking the dopamine through the D2 receptor blockers like haloperidol. That's it. Okay, so that's as simple as that. Now jump into the question number 2. I hope you are enjoying this. Dopamine and negative symptoms schizophrenia. Negative symptoms of schizophrenia such as apathy, flat affect, social withdrawal. Okay, what is the name itself is indicating the negative symptoms schizophrenia are associated with the decreased dopamine activity in which pathway? Pause the video for a few seconds and give your response. Mesolimbic, nigrostriatal, tubuloinfundibular and mesocortic. Okay, yes, I hope you have given the right answer. That's the mesocortic. As you have heard about the dopamine reward pathways, that's the mesocortic. Mesocortic is the brain area where the dopamine is playing a very important role for giving the pleasure, and also we are getting more motivated about the doing things. But when the dopamine activity is reduced in the mesocortic, that causes the negative symptoms like a social withdrawal. We are not feeling any kind of pleasure, we are not motivated to do anything. That kind of activities are primarily because of the less activity of the dopamine at the mesocortic area. So which kind of medications can be given here? Here we have to give the medication that can indirectly increase the level of dopamine. Increase the level of dopamine can be achieved by blocking the receptor of 5-HT2. If we are blocking the 5-HT2 receptor, that can increase the level of dopamine as the mesocortic. Yes, that's why we are giving the atypical antipsychotics, means newer antipsychotics that have a unique kind of effect. So negative symptoms because of the dopamine less activity at the mesocortic, and that can cause the negative symptoms that can be treated by the medications, those who are going to block the 5-HT2 receptor and increase the dopamine level. The second liner is avoid the medication those who are the typical antipsychotics like haloperidol, because that can make a worse of your negative symptoms. Okay, so this is bulletproof point for your exam, and let's move to the question number 3. Okay, dopamine and prolactin relationship. This is very unique concept. Okay, dopamine physiologically inhibit the release of which hormone from anterior pituitary gland? Pause the video for a few seconds and give your response. That's a growth hormone, cortisol, prolactin or thyroxine. Yes, you have given the right answer. That's the prolactin. Prolactin and dopamine have an inverse relationship. The first of all, you have to understand what is the role of prolactin. Prolactin have a primary role in lactation. Okay, after pregnancy, breast milk secretion is because of the prolactin. Breast size enhancement is because of the prolactin. That means when we are giving medications like dopamine blockers, dopamine blockers, like in schizophrenia, these kind of medications are increase the level of prolactin. That increase the level of prolactin, and that can cause the galacturia. Galacturia means the secretion from the breast. Second is that can cause the gynecomastia. In male, if giving such kind of medications, that can increase the size of the breast. So what is the role of dopamine antagonist in prolactin? Like in a pregnant woman, if she is not getting lactation, we are giving medications like a dopamine antagonist, domperidone and metoclopramide, that increase the breast milk secretion. That is the primary use of dopamine antagonist for increasing the prolactin level. So prolactin and dopamine relationship is inversely proportionate relationship. That is very important to remember. Okay. Now move to the question number 4. Antipsychotics and prolactin elevation. Prolactin elevation. Definitely, when we are giving the antipsychotics, that can change the prolactin level. Okay, what is the question? Blocked of dopamine D2 receptor, blocking of dopamine D2 receptor in tubuloinfundibular pathway most commonly cause which kind of adverse effect? Pause the video for a few seconds and give your response in the comment box. Okay, Parkinsonism, hyperprolactinemia, sedation, or orthostatic hypotension. Mainly that can cause in tubuloinfundibular pathways is hyperprolactinemia, because we are blocking the D2 receptor. So relatively that increase the concentration of prolactin, and that cause the hyperprolactinemia. Hyperprolactinemia can cause two things. One is galacturia and the second is gynecomastia. Done. So you are doing really good. You are so intelligent. Now move to the question number 5. That's a dopamine and Parkinson disease. This is a very simple question. Parkinson disease results from the degeneration of dopaminergic neuron in which brain structure? This is very simple. Pause the video for a few seconds and give your response. That's the substantial negro. This is the pathogenesis of the Parkinson disease, because the degeneration of the dopaminergic neuron in the nigrostriatal pathway, and that causing the balance and motor related problem. Now jump into the question number 6. That's the dopamine and acetylcholine balance. Okay, so what's the relationship between the acetylcholine and dopamine? The motor symptoms of the Parkinson disease are primarily due to the imbalance between the dopamine and which neurotransmitters? Pretty straightforward, pretty simple. Okay, so serotonin, GABA, noradrenaline, or acetylcholine. Pause the video for a few seconds and give your response. Yes, you are right. That's acetylcholine. Because the relatively, when the dopamine level is low, acetylcholine is relatively high. This imbalance is causing the balance and motor related symptoms. When the acetylcholine is high, we are getting the more tremor kind of symptoms. Okay. So dopamine and acetylcholine relationship is very important to understand with the Parkinson perspective. Jump to the question number 7. Cardiogenic shock. Okay, dopamine and cardiogenic shock. This theory is also very important to remember. At a moderate dose, dopamine improve cardiac output mainly through the stimulation of which receptor? Alpha 1, beta 1, D2, or muscarinic receptor. Pause the video for a few seconds and give your response. Okay, I give you the very clear theory about the dopamine peripheral effect. Okay, so far we have discussed about the central nervous system. Now we are talking about the peripheral. Peripheral, low dose of dopamine that's act on D1 receptor. Okay, dopamine 1 receptor that is primarily present in kidney. So when we are giving a low dose of dopamine, that is causing the vasodilation at the renal and increase the renal blood flow perfusion, and that can revive the cardiogenic shock. The second, at the moderate dose, that also affect on the beta 1 receptor. Beta 1 receptor that stimulate the cardiac output and also the force of contraction. So moderate dose beta 1, and at the high dose that effect on the alpha 1 receptor and cause the vasoconstriction and cause the blood pressure. That means when we are giving low dose D1, moderate B1, high dose alpha 1. That's it. Okay, so this is a very interesting concepts to remember. Now let's move to the question number 8. The dose dependent effect of dopamine. Dose dependent. Low dose dopamine produce the renal vasodilation primarily by activating which receptor? Pause the video for a few seconds, and I have already given the answer, so your answer is absolutely right. That's true. D1 receptor, low dose D1 receptor. So in your screen there is a extra exam points. You have to remember this: low dose D1, moderate B1, high dose alpha. Okay, dopamine and depression. Dopamine and depression. We have already talked that this point in mesocortic pathway. Okay, so which symptoms of depression is most closely associated with the decrease the dopamine activity? Pause the video for a few seconds and give your response. Anhedonia. Anhedonia means not motivating to do anything. I'm not motivating to do anything. I'm not feeling pleasure to do anything. That is the anhedonia. Not feeling pleasure to do anything. This is the depression symptoms mainly because of the dopamine activity is reduced in mesocortic area. In this situation, this kind of depression, we must not have to treat with the SSRIs or tricyclic antidepressant, because these kind of medications are change the level of serotonin. Okay, and the serotonin level is increase that further decrease the dopamine level, and that can worsen the depression symptoms. So we have to use the medications like a bupropion. That's the bupropion is reuptake inhibitor of the dopamine, and that's why that increase the level of dopamine at the synaptic level, and that reduce the symptoms of this kind of depressions. Okay, so dopamine related depression can be treated with which medication? This is a very important. Anhedonia, that's the indicate the dopamine deficiency, and bupropion kind of medications can be used for the management of such kind of symptoms. Okay, so last question is dopamine and Alzheimer's. So which neurotransmitter deficiency is primarily responsible for Alzheimer's disease, while the dopamine has a secondary? Pause the video for a few seconds and give your response. This is very simple, very straightforward questions and very straightforward answer. Yes, you are right. That's the acetylcholine. That's why in Alzheimer's medications, we are trying to increase the level of acetylcholine by giving the medications like anticholinesterase. Anticholinesterase, we are inhibiting the cholinesterase enzyme, and that's minimize metabolism of the acetylcholine and ultimately increase the level of acetylcholine. Encapsulate everything whatever we have discussed in 1 second. So the point number 1, mesolimbic, increase the dopamine level in mesolimbic, that can cause the positive symptom schizophrenia. Okay, decrease the level of dopamine at mesocortic, that can cause the negative symptom schizophrenia. Dopamine and prolactin is inversely relation. When we are giving the dopamine, that is decrease the prolactin level. When we are blocking the dopamine, increase the prolactin level. That's the inverse relations. Then the Parkinson disease. Okay, Parkinson disease, dopamine decrease, acetylcholine. Then the dopamine dose, peripheral, low dose D1, high dose B1, moderate dose B1 and high dose alpha 1. Anhedonia, dopamine deficit. When the dopamine deficit at the mesocortic area, that can cause the anhedonia, this kind of like don't getting any kind of pleasure. So this is the very important concepts for your examination. And if this video has added any value in your learning process, please subscribe the channel, and every week on the Friday we are going to discuss this kind of multiple choice. If you haven't seen the episode number 1 and 2, please watch. I'm going to provide the link in the description. Okay, and if you want to join the Pharma Vision community, definitely the link is also given in the YouTube channel.